Are you ready? Secretary of State ready? Order, order. I call the Secretary of State for Health and Social Care to make a statement. Secretary of State.
Thank you very much, Mr. Speaker. And Mr. Speaker, with permission, I'd like to make a statement on coronavirus. The threat remains grave and serious. In Europe, positive cases are up 40% from 1 week ago. And in Italy, Belgium and the Netherlands, they've doubled in the last fortnight. And here we sadly saw the highest figure for daily deaths since early June. Mr. Speaker, let us be under no illusions about the danger posed by this virus. Coronavirus is deadly and it's now spreading exponentially in the UK. We must act to prevent more hospitalisations, more deaths and more economic damage. Because we know from recent history that when this virus keeps growing, unless we act together to get it under control, this is the result. Our strategy is to suppress the virus, supporting the economy, education and the NHS, and local action is at the centre of our response. The virus is not spread evenly, and the situation is particularly severe in some parts of the country. Through the Joint Biosecurity Centre and through NHS Test and Trace, we've built up a detailed picture of where and how this virus is spreading. This week's NHS Test and Trace statistics show that testing capacity is up, testing turnaround times are down, and the distance travelled for tests is down too. And thanks to this capacity and this analysis, we've been able to take a more targeted approach, keeping a close eye on the situation in local areas, bearing down hard through restrictions on a local level where they're necessary. Now, I know that these restrictions are difficult for people. I hate the fact that we have to bring them in, but it is essential that we do bring them in, both to keep people safe and to prevent greater economic damage in the future. And when a virus is moving fast, we cannot stay still. If we act collectively, we know we can control the virus because we have done it before. I believe in the people of this country. And I believe, in fact, I know that the people of this country want to control the virus to protect their loved ones, their lives, and their livelihoods. And I believe from the bottom of my heart that acting together, we can. We must take firm and balanced decisions to keep this virus under control. This is the only way to protect lives and livelihoods. And we must act now. Delayed action means more deaths from COVID, it means more non-COVID deaths, and it means more economic pain later, because the virus comes down slower than it goes up. So we should stop it going up in the first place. And unless we suppress the virus, we cannot return to the economy we've had. Unless we suppress the virus, we cannot keep non-COVID NHS services going. And unless we suppress the virus, we cannot keep the elderly and the vulnerable safe and secure. Now, Mr. Speaker, I didn't come into politics to put restrictions on people's lives, and I want people to have as much freedom as possible, subject to not harming others. But the nature of this virus means that any one of us can inadvertently pass it on without even knowing. That is the liberal case for action. And I believe that the British people get that. But I want that action to be as targeted as feasibly possible. Local action is one of the best weapons we have. And Mr. Speaker, we have seen how local action can flatten the curve, for example, in Leicester and Bolton. This is the principle that sits behind our new, simpler system of local COVID alert levels. I'm pleased that the House approved these measures earlier this week. Yesterday, I chaired a meeting of the Local Action Committee Gold Command. This brings together the best data, the best clinical and public health expertise to look at how the virus is spreading. Turning first to parts of the country where prevalence of the virus is highest. Discussions are ongoing with local leaders on moving from high to very high. These are areas where transmission rates are rising at the sharpest rate and where we see a very real risk to the local NHS. The Liverpool City region moved into the very high level yesterday, and I want to thank the local leadership for their public service and cross-party teamwork in the face of this virus. We've developed a substantial package of support for areas that enter this third tier, and this includes more support for local test and trace, more funding for local enforcement and the job support scheme, of course, alongside the offer of help from the armed services. And in other areas currently in the second tier, where discussions are ongoing, no further decisions have yet been made, but we need to make rapid progress. Mr. Speaker, turning to other areas of the country currently in the medium level, where rates are rising fast. First, in London, infection rates are on a steep upward path, with the number of cases doubling every 10 days. The 7-day average case rate stands today at 97, rising sharply. We know from the first peak that the infection can spread fast and put huge pressures on the NHS, so we must act now to prevent the need for tougher measures later on. So working closely with the Mayor, with cross-party council leadership, with local public health officials and the national team, we've together agreed that London needs to move to local COVID alert level high. I want to take a moment to thank all those involved for their exemplary hard work, the collegiate nature of decision-making, the collaborative approach, and the constructive work, all focused on the public health and economic well-being of our citizens. And to Londoners, and to all who work in our great capital, I want to say thank you for what you've done to suppress the virus once. We now all need to play our part in getting the virus under control once again. And I know the sacrifices this means, but I know that if we work together, we can defeat this. Working with local leaders in Essex and Elmbridge, we're also moving them into local alert level high. And I want to pay tribute to the leadership of Essex County Council and in Elmbridge, where they've been working so hard to suppress the virus. Mr. Speaker, infection rates are also rising sharply in Barrow-in-Furness, in York, in North East Derbyshire, in Erewash and Chesterfield. In all of these places, cases are doubling in less than a fortnight. For all of the areas entering the high alert level, the change will come into effect 1 minute past midnight on Saturday morning, and this includes Barrow-in-Furness, York, North East Derbyshire, Erewash and Chesterfield too. The central change is that people cannot now meet other households socially indoors. This applies in any setting, at home or in a restaurant or in any other venue. The rule of 6 still applies in any outdoor setting. And although you may continue to travel to open venues, you should reduce the number of journeys where possible. Now, I know that these measures are not easy, but I also know that they are vital. Mr. Speaker, responding to this unprecedented pandemic requires difficult choices, some of the most difficult choices any government has had to make in peacetime. We make these decisions with a heavy heart, with the sole aim of steering our nation through troubled waters. Things will get worse before they get better, but I know that there are brighter skies and calmer seas ahead, that the ingenuity of science will find a way through, and until then, we must come together, because we all have a part to play in defeating this dreadful disease. And I commend this statement to the House.
Now call the Shadow Secretary of State, Jonathan Ashworth, to reply. Jonathan?
I'm grateful, Mr. Speaker, and I thank the Secretary of State for advance sight of his statement. Given what we know about rising prevalence of the virus, given what we know about rising admissions to critical care, I totally understand why he has had to make difficult decisions today on Tier 2 for London and other areas, including Erewash and Essex and Barrow and Chesterfield and so on. I hope he will agree that when decisions like these are made, they are most effective when made in tandem with local leaders. And on that point, can he just update us? What is the current position with respect to Greater Manchester and Lancashire? And should we anticipate further announcements on that front later today? But also, while I don't quibble or object to the public health interventions he is making, I am afraid they are still not backed up with the financial package that is needed to mitigate their impact on jobs and livelihoods. More people will fall into poverty and destitution. Families across, for example, Bury and Bolton, small businesses across Burnley and Hyndburn or London have been failed by the Chancellor. So I urge him and the government to introduce a stronger package of financial support for those areas in Tier 2 and Tier 3. The British people have made tremendous sacrifice already, and we are heading into the bleakest of winters. Much of this could have been avoided if the misfiring 12 billion test and trace system had been fixed over the summer. Today, the new figures show just 62% of contacts reached. That's equivalent to 81,000 people not reached circulating in society, even though they've been exposed to the virus. This is another record low. And yesterday we learnt that consultants working on test and trace are being paid over £6,000 a day to run this failing service. In a single week, the government is paying these senior consultants more than they pay an experienced nurse in a year. So can the Secretary of State explain why such huge sums of money are being paid to consultants to run a service that is only getting worse? Now, the Prime Minister yesterday said these new restrictions that he's bringing in will bring the R below 1. But while the virus growth is accelerated in northern regions, the embers are burning bright nationwide. And let me repeat to the House, and the Tory party staff are welcome to clip me again for Twitter. It'll save my staff the trouble. A full national lockdown, stretching for weeks and weeks and weeks, like we had throughout April, May and June, would be disastrous for society. But we are urging him to adopt a short, time-limited 2 to 3 week circuit break to take back control of the virus, to reboot and fix test and trace, to protect the NHS, to save lives. SAGE has recommended a circuit break. NHS providers say they are urging politicians to listen to the scientific advice and move fast and decisively. The SPI-M subgroup of SAGE says a circuit break of 2 weeks will save almost 8,000 lives. And for all the kind of ponderous blustering and carping from the Prime Minister yesterday, he actually told the House, with some haste, as if he didn't want his backbenchers to hear it, I rule nothing out with respect to a circuit break. So the Prime Minister has not ruled it out, which we welcome. So what are the government's criteria for a national circuit break? How many hospital admissions? How much non-COVID care delayed? Dare I say, how many more deaths? Action is needed now. Plans need to be put in place today. Everyone accepts the government were too slow in the spring. How certain is he that his government is not making the same mistakes again with more catastrophic consequences? This is a moment in history. Look around, Health Secretary. Explain why not a circuit break now. Because if we do this in a few weeks or a few months' time, more lives and livelihoods will be lost. So in the national interest, I offer to work constructively with him today to deliver the circuit break that is now needed.
Thank you very much, Mr. Speaker. Well, as I said in my statement, the discussions with local leaders in other parts of the country, in Greater Manchester, in Lancashire and elsewhere are continuing. And I don't want to preempt those discussions. Those discussions do, of course, include what financial support is needed. But we have put in place, I would remind the House, we have put in place unprecedented financial support to support those who are affected. He mentions test and trace. The figures this morning, in fact, show that there have been a record high number of people who've been contacted by NHS Test and Trace, reaching more people, testing more people faster than at any other point. And he might have seen that yesterday, internationally this was commented on as an area where we have done well here in the UK. So, of course, we want to make sure that we get things even faster and we have an even greater testing capacity. But I think he'd do better to reflect on the progress that has been made. Finally, he talks about the national circuit break idea that was the idea the Labour Party put forward at least on Wednesday this week. But what I gently say to the honourable gentleman, what I gently say to him is, here in this House, Labour calls for a national circuit break. We take the view that we should do everything we can to control this virus where it is rising the fastest and take a more targeted approach. But the Labour Party can't even get its mayors in other parts of the country where the cases are going up to come out and support the proposals that are made from that dispatch box. So what I'd say is that we need to work together, we need to pull together, everybody should come together, and that is the best way to defeat this virus.
We now come to the Chair of the Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. I support today's measures, but isn't the biggest issue we face as a country now uncertainty? Uncertainty about our health and uncertainty about the future of the economy. Given my right honourable friend's tremendous success in expanding our testing capacity, is not now the time to announce a date, whether it is February, March, April of next year, by when every single person in the population will be tested every week, so that by then, irrespective of progress on a vaccine, irrespective of the success of local lockdowns, irrespective of other uncertainties, we have a date by when we know we will get the virus under control and we know we have some prospect of returning to normality.
Well, Mr. Speaker, my right honourable friend and I share a passion for an expansion of testing capacity in this country, and he has long tried to persuade me to set yet more goals for the expansion of testing capacity. I'm very glad to say we've hit every single one that we've put in place, whether it was the 100,000 in the spring, and we're on track to meet the 500,000 by the end of this month. After that, I very much hope we can continue to expand testing capacity, and I'll look at the idea that he proposes very carefully.
Heading up to Scotland with the SNP spokesperson, Dr Philippa Whitford. Dr Whitford.
Thank you very much, Mr. Speaker. I recognise the need for this action, but it's critical that those called on to isolate, whether as individuals or through a lockdown, receive the financial support to do so. Avoiding the social and economic impact of repeated local lockdowns depends on driving down community transmission through testing and tracing every single case, and finding and isolating their contacts in the short window before they too become infectious. Tracing systems based on local public health teams, such as in Scotland, Wales, and now in some parts of England, have all outperformed the centralised Serco system, which has barely reached 3/4 of cases and well under 2/3 of contacts. I welcome that local public health teams will now be directly involved in contact tracing in areas of high COVID spread. But will the Secretary of State now have them lead contact tracing in all areas across England to help get the test, trace and isolate system working effectively? And will he ensure that appropriate financial resources are moved to local authorities to fund this? Unfortunately, the hospitality industry is being hit particularly hard, both by the virus itself and the restrictions to control it. As we now know, COVID is spread by airborne particles as well as droplets, and it has become clear that ventilation is key to reducing viral spread indoors. So will the Secretary of State ask the Chancellor to promote the installation of filtered ventilation units by removing VAT and making them tax deductible? That way the government could help the hospitality industry make their premises more COVID secure, rather than having to repeatedly shut them down every time cases surge.
Secretary of State.
Thank you very much, Mr. Speaker. Well, the Honourable Lady talks about the testing system, and indeed the UK-wide testing system is an example of this whole country working together to keep people safe. The UK system provides the majority of tests into Scotland and works very closely with the NHS in Scotland, who also, of course, provide important testing capacity. That is an example of the local system in Scotland and the UK system nationwide working together for the people of Scotland. She mentions the isolation payments, and I strongly agree with her on the importance of the isolation payments. Again, this is a proposal that we worked on together, the UK government providing the funding, being delivered across England and across Scotland as it is across Wales and Northern Ireland. I think the best approach to tackling this pandemic is across the whole country, people coming together and working together as we do between the UK government and the Scottish government, where an issue is devolved, delivering for the people of Scotland.
Richard Drax.
Thank you, Mr. Speaker. First, can I tell the Minister that no one wants to let the virus rip, and that language is unhelpful. Second, as I understand it, it's the government's intention to continue shutting down our country's economy to a greater or lesser extent, destroying the lives and livelihoods of millions of people in the process until a vaccine is found, which might never happen. And even if it does, there's no guarantee it will work. We need a plan B. And I'd be grateful if my right honourable friend would tell the House what that is.
Well, the plan, Mr. Speaker, as my honourable friend and I agree, that we can't let the virus rip. Therefore, we must act to suppress it. And suppressing it through local action in the first instance is the best tool that we have, whilst we work, of course, with the scientists on technology that can help us to do that better. And I put it to my honourable friend that this is not only best for health outcomes, although that is undoubtedly true, both for COVID and non-COVID health outcomes, but it is also best for economic outcomes. Because even though the restrictions, of course, have their impact, and I understand that and I feel that, that is better than the consequences of action that would have to be taken to ensure that we keep the virus under control, were it to get out of hand once again.
Said to Greater Manchester with Lucy Powell. Lucy Powell.
Thank you very much, Mr. Speaker. I've just come off a call with Greater Manchester colleagues and the Secretary of State's colleague about the widely speculated move of Greater Manchester into Tier 3. There was unanimous fury on that call about the process, about the evidence base, and about the economic support packages on the table. We want action, but it has to be the right action, because we've lived in Tier 2 now for nearly 3 months and it's not worked. The Chief Medical Officer says that measures in Tier 3 will not make a material difference to the infection rate, yet they will cause widespread economic damage to our region, costing thousands of jobs, tens of thousands of jobs and thousands of businesses. It's not good enough that conversations, meaningful conversations, only began this morning. So will he now ensure that those meaningful conversations come to a conclusion so that we can get infection rates down while protecting livelihoods and businesses?
Secretary of State.
Thank you very much. Well, I would urge the Honourable Lady to work together for the best outcome of the people of Greater Manchester. Of course, those conversations with the local leadership in Manchester have been going on for some time. I would also urge her to look carefully at what the Chief Medical Officer said, because it wasn't as she quoted. But I'd also point out that across Greater Manchester, cases are rising and they are already high. And to ensure that we support the NHS across Greater Manchester and to get this under control, action is needed fast.
On to Ben Spencer.
Thank you, Mr. Speaker, and I thank my right honourable friend for his statement today. It is absolutely right that we take measures to support the NHS and ensure that it is not overwhelmed with a high rate of COVID and non-COVID related deaths. With increasing rates in Elmbridge, in my part of my constituency, it is right to bring in these measures, and I pay tribute to the resolve of my constituents in Elmbridge and all my constituents, in fact, in dealing with this and getting us through this crisis. Local measures, though, are only part of the solution. Ensuring we have sufficient NHS surge capacity to deal with high rates of cases for non-COVID and COVID care is also there. With regards to the Nightingale hospitals and NHS care, what does he anticipate are the bottlenecks going forwards for surge capacity? Is it beds? Is it staff? Is it ventilators and other kit? And what is my right honourable friend doing to tackle that bottleneck?
Thank you very much, Mr. Speaker, and I welcome my honourable friend's thoughtful approach to the action that is needed in Elmbridge. Of course, Elmbridge's connection to Greater London is very intense, and the travel to work patterns mean that a huge amount of people who live in his constituency like him work in the centre of London, and his council have worked closely with the national team to make this decision. The expansion of NHS capacity is of course critical, as is controlling the virus, both of them. In London, we have not yet had to stand up the NHS Nightingale again, which is at the Excel Centre. We stand ready to do so if necessary. We now have a huge quantity of ventilators. We have the Nightingales for bed capacity. We have brought more people back into the NHS over the last 6 months, and we have people on standby, retired NHS staff. And of course, it's the combination of the three: the kit, the physical space, and the staff that you need to expand capacity. Unlike, for instance, in Manchester, where we are having to stand up the Nightingale Hospital again already, we're not yet at a point where we need to do that in London. And I really hope that pulling together and following the level 2 rules, that the people of London and Elmbridge can avoid that in the future.
Dr. Lisa Cameron.
Many thanks, Mr. Speaker. Many staff have put themselves on the front line to protect the most vulnerable, but have tragically lost their lives, leaving their families absolutely devastated. Alongside support, appropriate tribute must be paid to their sacrifice. As chair of the All-Party Health Group, I've written to the Prime Minister a number of months ago asking for a memorial to be commissioned in their honour, but as yet I've heard nothing back. So will the Secretary of State support bereaved families who have given their all, and at this time take this issue forward across government?
Yes, of course. We've done a huge amount to support bereaved families, and it's an issue very close to my heart, as she'll imagine. So I'd be very happy to talk to her about how we can take this forward.
Julie Marston.
Thank you, Mr. Speaker. My right honourable friend will, I'm sure, be aware that the World Health Organization has recently praised Hertfordshire health authorities for measuring the pulse and the feelings of our community through an online platform, and they've adjusted service provision accordingly. Would my right honourable friend agree that good local data could enable a district approach rather than a county-wide approach in Hertfordshire in the event that tier levels do have to be reassessed?
Yes, of course we look at a district-by-district approach, as the decision in Elmbridge attests. I'd say, Mr. Speaker, I mentioned Leicester and Bolton as areas where local action has brought the virus under control. Of course, in Hertfordshire, that's also absolutely true. There was quite a serious outbreak a month or so ago that was brought under control by a combination of the district councils, the county council, and the central team all working well together, crucially supported and effectively delivered by the people of Hertfordshire.
Sarah Sultan.
Thank you, Mr. Speaker. In March, the government was advised by the SAGE committee to lock down. The government delayed this by a week, and senior scientists estimate that the delay cost tens of thousands of lives. I fear that the same mistakes are being made again. 3 weeks ago, SAGE advised a circuit breaker lockdown. In Coventry, we've seen cases rise rapidly, with more than 100 new cases in 24 hours. So before it's too late, and there are tens of thousands of more avoidable deaths, I urge the Secretary of State to impose a circuit breaker lockdown and bring in the economic support that will get us through this crisis.
Secretary of State.
Thank you very much, Mr. Speaker. That isn't an accurate description of history, but it is a reasonable... but if that's how she feels about Coventry, I would say to her that we're working with the leadership of Coventry City Council, and if she were to talk to them as well, then I'd be very happy to ensure that she's part of that conversation.
Sarah Dines.
Thank you, Mr. Speaker. I've been contacted by a Derbyshire Dales constituent, Sarah Peake, whose grandfather sadly was taken into a care home. Now, in May this year, he's been married nearly 70 years. Sadly, because of COVID, he can't see his wife, with whom he's lived for 70 years, and his family also. Can my right honourable friend please update the House as to what's been done in relation to rapid testing to stop the scourge of loneliness in our care homes?
Secretary of State.
Yes, I was working on this issue of how we can safely allow visiting, especially of people who've been married for 70 years, which is an extraordinary achievement in and of itself, to allow visiting in a way that is safe, according to the risk level of the background rate of infection. Of course, testing can be part of the solution, as can be the use of PPE properly. We have more nuanced rules in place now than there were during the first peak, and I'd be very happy to work with my honourable friend to try to make sure that we get this get this right.
Rachel Basman.
Thank you, Mr. Speaker. I welcome the Secretary of State's greater attention on York announced today, but I am concerned that while in Tier 1, there are areas of the country in Tier 3 with a lower infection rate. And certainly, I do not believe the measures in Tier 2 are going to be sufficient to stop the spread of the virus in our city, which, as he will know, is rising incredibly sharply, and in the older population as well. York experiences real challenges every single winter because of the capacity issues at our hospital, and without taking more acute action now, I'm concerned we're going to be in serious difficulty in just a few weeks' time.
Well, Mr. Speaker, we are expanding capacity at the hospital in York. And of course, in York, there are two overlapping epidemics, one amongst students and one amongst the general population. As she says, though, this is increasing in spread in the older population, who are, of course, the most at risk from COVID. The number of cases increased by 60% in York over the last week. So I welcome her support for the measures that we're taking, and of course I'm very happy to continue to talk to her about what more may be needed, because this is best done on a cross-party, cross-community basis. And my message to everybody in York, a city I know and love, is that it is so important that all of us abide by these rules, reduce social contact, and that way we can start to get the increase in the number of cases in York coming down.
Let's head to Suffolk with Dr. Dan Poulter. Dr. Dan Poulter.
Thank you, Mr. Speaker. And may I draw the House's attention to my declaration of members' interests as a practising NHS doctor who's been practising on the front line during the pandemic. The Secretary of State is right to introduce these measures today, and he's right to see a full national lockdown as a very last resort. But can I bring him back to the issue of testing? Now, there's been tremendous strides made in expanding national testing capacity to many hundreds of thousands a day from a standing start. But there are still specific challenges faced by a number of hospitals in terms of getting NHS staff tested. And I'm aware of some hospitals that are only being offered 15 tests a day for their staff. Would you please be able to look into this matter urgently, because it's vitally important that the NHS has the staff available to treat the patients, particularly given the second wave that we're now facing?
Absolutely, we're making very significant progress in this area. He'll have seen the announcement by the NHS on Monday that in Tier 3 areas we're expanding the asymptomatic testing of members of NHS staff. We're also expanding the capacity for COVID tests within the NHS itself. He's absolutely right to raise it, and we're making a lot of progress.
Heading up to Greater Manchester again with Barbara Keeley. Barbara Keeley.
Thank you, Mr. Speaker. We know that case rates are rising in Greater Manchester, but as the Chief Medical Officer has made clear, imposing new restrictions on its own will not be enough to turn this situation around. Instead, we need people to be supported to do the right thing, and we need to use appropriate enforcement powers where they don't. What we need from government is additional financial support for businesses and for local authorities in Tier 2 and Tier 3 areas so that they can support employees to follow the rules. And we need to expand the staffing and resources of our excellent local contact tracing services rather than continuing to pump billions into a national system which is less and less effective at contact tracing.
Secretary of State.
Well, Mr. Speaker, we are putting in more support, and if any area goes into the third level, into Tier 3, then it gets further support. We are putting more into local test and trace, although local test and trace on its own will not work as effectively as the partnership, which is, as I said from the figures, which is improving and expanding all of the time. But I welcome the fact that the Honourable Lady recognises the sharp rise in cases in Greater Manchester and the need to act, and I very much hope that we can act on a cross-party basis, but act we must.
Thank you very much indeed, Mr. Speaker. Mr. Speaker, a lot of weight is being shouldered by the Joint Biosecurity Centre, engaged in decisions that are having big consequences for millions of people across the country. And it's concerning that there wasn't anything in the statement from the Secretary of State about the criteria for exiting these measures. But when it was created on the 20th of May, SAGE was told that the Joint Biosecurity Centre would, and I quote, pursue a reputation as an organisation that the public can trust. This will require them to be an exemplar in terms of honesty, openness, competence and independence. Yet nearly 5 months on, it hasn't disclosed the minutes of any of its meetings, the papers that it's drawn on, or even who sits on its boards, despite a commitment on its own website to do so. So if it is to be the exemplar that it has been billed to be, and that the public can have trust in it, given the importance of these decisions, will the Secretary of State order that openness without delay?
Secretary of State.
Well, yes, Mr. Speaker. In fact, very shortly, the Joint Biosecurity Centre will be making its further of its analysis public. It works within the department. Its officials are civil servants, and so therefore it is different to SAGE in that way, which SAGE is made up of independently employed scientists. But nevertheless, my right honourable friend makes an important point on which we are acting.
Thank you, Mr. Speaker. And as a London MP, can I start by saying thank you for the briefing call that London MPs had with the Care Minister and officials this morning about today's announcement. There were, however, a number of questions that remain unaddressed both in that call and in today's statement. Namely, could the Secretary of State advise the House what the evidence is behind the measures he's implementing in London, what modelling has been done on their impact, and how long he expects these restrictions to last?
We are seeking to publish further evidence on the impact of measures. For instance, I've mentioned often Leicester and Bolton. In Bolton, where the curve was flattened, in Leicester we brought it down with a much more strict intervention than one we're proposing in London. We are proposing to publish further information on the analysis of the impact of measures like these. The fundamental science is really simple, which is that the more people congregate, the more the virus is passed from one to another, and that's why the restriction of social activity between households indoors is an important part of restricting the spread of the virus. All those areas in level 2 are reviewed fortnightly, and of course, if we can bring any area, especially including London, out of level 2 faster, then that's even better. And I'm working with the cross-party London councils and the mayor on setting out more details of the way that London can exit these measures and get down to level 1. Now, of course, ultimately, Mr. Speaker, and as soon as possible, we all want to get to level 0, which is normal life.
Let's head to the southwest with Anne-Marie Morris. Anne-Marie.
Thank you, Mr. Speaker. Could the Secretary of State please explain what formal and detailed assessment his department has made of the long-term health cost a second blanket long lockdown would have on the physical and mental, not just COVID-related health of the population, and whether he believes that it's an acceptable trade-off?
Secretary of State.
Mr. Speaker, I've looked into this in great detail, as she'll imagine, and my honourable friend is experienced in these areas, and the result of what I've looked at is that there is no trade-off. If COVID gets out of hand, then that increases the non-COVID ill health and non-COVID deaths too. And when it comes to mental health, I was talking only yesterday to the Royal College of Psychiatrists, who are clear that a second peak getting out of hand is bad for mental health, not least because of the mental health impacts of long COVID, of people who survive COVID, but for whom the condition lasts for months and months, which is an issue very, very close to my heart. So there has been this proposition put forward that there is some trade-off between COVID health and non-COVID health. Having looked into it in great detail, it is false. The best way to improve the non-COVID health of the nation is to ensure that COVID stays under control.
Tammy.
Thank you, Mr. Speaker. During a coronavirus briefing for members on Monday, the Deputy Chief Medical Officer, Jonathan Van Tam, said of the pandemic, it is very easy to lose control and harder still to regain it. So only yesterday, the Department of Health released figures which stated that 19,724 people are tested positive for the virus. With positive cases and hospital admissions increasing across the country, death rates are sadly rising, and with the admission of his own scientific advisors that there is many more to come, does the Secretary of State believe that more can be done to gain back control and stop the spread of this deadly disease? And does he believe the proper financial support is in place for people in need in these high and very high risk areas?
Yes, I do think more action is needed, and that's why we're taking it today.
Caroline Johnson.
Thank you, Mr. Speaker. Mr. Speaker, the Prime Minister has been very clear in the risks of obesity of those who get coronavirus, and that people who are obese have a more severe disease course than those who are slimmer. But in Tier 3 areas, many gyms are being closed and many sporting activities are being restricted. So what is the Department of Health doing? What is the Secretary of State doing to ensure that we can encourage activity in people who are in those areas? Perhaps a workout to help out scheme with free online activities targeted to each age group and each physical ability.
Mr. Speaker, I love the idea of work out to help out. It is undoubtedly true from the science that I've seen that obesity contributes to a worse impact on you if you catch coronavirus. It's something the Prime Minister has spoken about with great passion. And it's something that we want to tackle. So I'll absolutely look into that idea. But I'd also say that we've changed the proposals both for people who are shielding and even in the highest risk, very high Tier 3 areas, to always be clear that outdoor exercise is a good thing.
Justin.
Thank you very much, Mr. Speaker. My constituents are being denied routine blood tests because the Swiss company Roche that supplies the labs in Bedford is having supply chain issues. If one company with one supply chain problem can cause a national shortages of medical components vital to patient care for at least 3 weeks, is the Secretary of State as concerned as I am for the disruption to medical supply chains during a pandemic when we leave the EU in just over 2 months?
Mr. Speaker, we have prepared now for years to ensure that we have the supplies that are needed, and I've been in contact with Roche, of course, over this distribution issue, which is actually about a distribution issue from a warehouse in England. These distribution issues do happen from time to time in very large organisations like the NHS, and we're working closely with Roche, and I thank them for all their efforts in solving this technical problem.
Tim Lawton.
Thank you, Mr. Speaker. I agree with the local approach my right honourable friend is taking, and he has a judgment based on balancing what the science is telling, what the economy is telling, and the sustainability by public consent. But I'm concerned about care homes, Mr. Speaker. My care home managers tell me that their staff are knackered. They are exhausted from covering extra shifts from other staff who are isolating and have got childcare challenges, from dealing with online GP appointments because GPs will not visit those homes, and dealing with angry relatives, particularly of EMI residents, because they can't visit them face to face. What can we do to help sustain those care home staff, and in particular to approve volunteers from that massive register we've got to help share the load?
Yes, I'm very happy to take up my right honourable friend's suggestion in terms of the volunteers. I would commend to him the social care winter plan, which sets out how we balance the very difficult issues that he mentions.
Kate Osborne.
Thank you, Mr. Speaker. In my constituency of Jarrow, there are already schools closing due to confirmed cases of coronavirus. What conversations has he had about the routine testing in schools, and will the Secretary of State publish the science behind the decision to not introduce routine testing for teachers, and tell us why schools have only been issued with 10 testing kits each?
Well, yes, we have a testing prioritisation board that takes into account the order of priorities within testing. Of course, as testing expands, it means that we'll be able to use it for more things, including in schools. And I look forward to being able to make that progress just as soon as we get this expansion even bigger.
Let's board a question from Bob Blackman. Bob Blackman.
Thank you, Mr. Speaker.
London as a whole is going into tier 2 as a result of the infection rate being at an average level of 97. But as my right honourable friend will be well aware, the actual levels of transmission in different London boroughs are widely different. So can he set out what criteria will now be used for London to reduce from tier 2 to tier 1? Will it be a case that every London borough has to come down below a given rate before that can happen? Because otherwise we're going to have a position whereby this short-term period could extend for many months. So could he set out what the criteria will be used to get us down to tier 1?
Secretary of State.
I want the time that London is in tier 2 to be as short as possible, and the best way we can achieve that is all pulling together and following the level 2 rules. What I'd say is, in terms of exiting from level 2, is that the cross-party London group set out a very clear set of criteria about the need to go up a level, including reaching 100 per 100,000 cases on average across London, which we are just about to breach. And they are now working with us on what that might look like in terms of the exit. I totally agree with him on the importance of setting that out to give people the motivation that if we all pull together and sort this out, then we'll get out of these measures and people can live their normal lives a bit more.
Head to Scotland with Marion Fellows. Marion Fellows.
Thank you, Mr. Speaker. Scotland made use of a summer of lower cases to get its public health-based contact tracing system up and running, which is reaching over 90% of cases and contacts. Can the Secretary of State tell us by when the UK government hopes their Serco track and trace will reach even 70% of community contacts?
Secretary of State.
Well, just like in the way that we do it in England is that the national system and the local systems work together. And so the first proportion, the majority of cases, are dealt with by the national system, and then the local systems come into action. So between them, they reach a very high proportion of the cases. And it's that teamwork that's the best way forward.
Thank you, Mr. Speaker. Today there are thousands of people working in hundreds of private businesses contributing to the testing endeavour. Would the Secretary of State agree with me and pay tribute to them that they are key workers in every respect?
Here.
Yes, I would. I mean, in contrast to some of the comments, although sotto voce, I think now from the opposition, it is the teamwork between people working in private businesses who are part of the national endeavour to defeat this disease, working with people in the public sector who are working in the national endeavour to defeat this disease. It is a big team effort, and let not us divide people where people should be brought together.
Let's head up to Yorkshire with Richard Bergen. Richard Bergen.
Thank you, Mr. Speaker. Serco is at the heart of an outsourced tracing system that's failing to contact 1/3 of all the close contacts of those with coronavirus. That's clearly helping the virus to spread out of control. So there's widespread public concern that the government is in hock to these giant outsourcing companies. Concerns that Serco and the like aren't just ripping off the public, but they're putting lives in danger. So does the Secretary of State think that the public should be reassured or worried by the fact that Serco's former chief spin doctor is now his Minister for Health?
Well,
Secretary of State.
Mr. Speaker, I don't think he was listening to the debate. Do you? Because I just previously pointed out not only that the national system in the last week has more than doubled the number of contacts that it's reached, more than doubled, and I pay tribute to them for that, that it is the teamwork between the national and the local system that works best, and that it is the combination of the large-scale private organisations and the public sector, people working together, that is able to deliver a better service. And I'll tell you this, Mr. Speaker, there was a time in the last few days when we had requests from local systems to bring some of the contact tracing back into the national Serco system so that they could help to reach more people. And that sort of teamwork is what I look for, instead of the negative, derisory, divisive approach of the honourable gentleman up there.
Thank you very much, Mr. Speaker. Would my right honourable friend care to reflect that a number of us in London regard it as neither targeted, nor proportionate, nor appropriate to use a London-wide average in so large a metropolitan area where so little commuting is now taking place? Will he reflect upon this on the future, and will he speak today to the Chancellor of the Exchequer to see what support can be given to hospitality businesses in the London suburbs who are suffering as of now as a direct consequence of his decision?
Well, Mr. Speaker, what I'd say is that, of course, across London there's a huge amount of travelling to work, and although, of course, in the different boroughs the rates are different, he's absolutely right about that, and in his patch, Mr. Speaker, they are lower than the London average. Nevertheless, unfortunately, they are rising sharply, and so this action we considered a borough-by-borough approach. But because of the integrated nature of London and because, unfortunately, cases are rising fast across London, we decided that the best approach is for the whole of London to go into level 2 together.
Heading up to Greater Manchester to Tony Lloyd. Tony Lloyd.
Thank you, Mr. Speaker. And as I've got to say to the Secretary of State, as another Member of Parliament who, in his words, is up there, does he understand that people in Greater Manchester do fear that an indefinite period in Tier 3 means that we will see the pauperisation of our people, the destruction, at least in the short and medium term, of our economic capacity, with no certainty, unless he really does get test, track and trace working, not just improving, but well, that we will come out of this no better than when we go in.
Mr. Speaker, by up there I meant on the screens at the top of the chamber rather than anywhere geographically. What I would say to the honourable gentleman is that the best way to avoid the outcome that he seeks to avoid is for everybody across party lines, across communities, to pull together to get the public health messages out that we need to work together to deliver for the people of Greater Manchester and all other areas of the country.
Andy Carter.
Thank you, Mr. Speaker, and can I thank the Secretary of State for his statement this morning, and can I say to him, as a member representing a constituency in the northwest of England, thank you to him for his continued engagement and for that of the department as well. He does speak on a regular basis to members in the northwest. I can say that, hand on heart, I regularly speak to him about the issues in my constituency. My right honourable friend will know that hospital admissions in my constituency are continuing to rise, and there is pressure on the health service there. We've moved from 40 inpatients a week ago to 80 today. Can my right honourable friend tell me what support he's giving to Warrington Hospital so that normal NHS treatment can continue in an uninterrupted fashion?
Mr. Speaker, as a Cheshire boy myself, of course I talk to my honourable friend as I do to colleagues right across the country. And Warrington is close to my heart. My grandfather used to live next to the golf course in Warrington, and the hospital there is a very, very good hospital, but it is under strain, and we're making sure that the whole region supports the hospitals that are under strain with COVID admissions, which I'm sure he would welcome, and is, of course, one of the advantages of having our great NHS.
Dan Carlton.
Thank you, Mr. Speaker. The whole country knows the perilous situation facing the city of Liverpool and the North West region. People are very worried out there, and not least the people who were officially shielding previously. Can I ask the Secretary of State, what is the latest scientific advice? And can I call on him to reintroduce that advice and financial support with it?
Yes, on Tuesday this week we set out the details for the approach we take to clinically extremely vulnerable people in this second phase. I will write to him with the details of that, and he might want to take up the offer that I can make to him of a meeting with the Deputy Chief Medical Officer Jenny Harries, who leads on that programme.
Heading up to Rutland and Maitland with Alicia Kearns.
Thank you, Mr. Speaker. I thank my right honourable friend for his support for my campaign to ensure all women have partners for scans and labour, and I'm grateful that NHS trusts have seen a significant reduction in unnecessary measures. But today I ask for clarity. Should pregnant women in their third trimesters be shielding given their much higher vulnerability to COVID-19? And does he agree that employers must take account of this higher risk and support them to work from home or from jobs that aren't on the front line?
Well, of course, employers should take a duty of care towards their employees who are pregnant. When it comes to the formal shielding advice, Maybe she would join the honourable gentleman who spoke just a moment ago in a briefing with Jenny Harries, and I'll also send her the updated guidance to make sure that we get this exactly right for people in the third trimester of pregnancy.
Sir Owen.
Thank you, Mr. Speaker. At the first Joint Select Committee's meeting of the COVID inquiry this week, we heard evidence from a care home manager that said a member of her staff had to wait 9 days for her results. 9 days, Mr. Speaker. If I was in charge of that shambles, I would struggle to look at myself in the mirror, let alone get up at that dispatch box and have the gall to tell the public that testing is anything but a failure. When will this government get a grip of testing?
Secretary of State.
Thank you, Mr. Speaker. The turnaround times for tests have come down very significantly, and including for care homes over the last few weeks have come down, and we work incredibly hard to get them down. Even whilst there was the most acute pressure on testing capacity, we kept the testing, the weekly testing for care staff, and I think the whole House can unite behind that.
Mike Wood.
Thank you, Mr. Speaker. Whilst it's clear that the measures taken in the spring helped to slow the spread of the first outbreak, at the end of what was supposed to then be a 3-week lockdown, the daily cases had trebled and daily deaths were up 750%. If there was to be a so-called circuit breaker national lockdown, how would it be possible to judge after 2 or 3 weeks whether it was safe to lift those restrictions?
Yeah, exactly.
Well, the approach that we're taking is to try to take as a local approach as possible, partly because we have to ensure that we take measures that are proportionate, and there are some areas of the country, including Dudley, where the cases are lower even than close neighbours, in his case, across the West Midlands. And that is the reason that we set out, as the Prime Minister set out on Monday, that we're taking the tiers approach, which I think helps public understanding because it's really simple, but also allows us to take the action where that's necessary.
We've lost Rosie Cooper. Connection's gone down, so we'll go to Lynn Saxby in the southwest. Lynn Saxby.
Thank you, Mr. Speaker. Does my right honourable friend agree with me that the opposition should not play politics with people's lives and livelihoods, and a national circuit break lockdown is not the answer, particularly for areas such as my North Devon constituency, where COVID cases per 100,000 are still less than 40?
My honourable friend sets out why, with case rates like that, why we're focusing our attention on the parts of the country where there is the most serious problem. And throughout this, we try to ensure that we take action that is necessary, but that is proportionate in order to slow and stop and suppress this disease.
Heading to Lewisham with Vicky Foxcroft. Vicky Foxcroft.
Thank you, Mr. Speaker. Communication for shielding people has been poor in the past. Now, sadly, as we return to further restrictions, communication remains poor, with news being fed to the press before updating the country in a clear way. This really isn't good enough. They've had 7 months to get this right. Now, when letters are sent out to shielding people, are you going to ensure they're in accessible formats, especially with many potentially being disabled people? And will you be letting them know what extra support they will be entitled to?
Secretary of State.
Thank you very much, Mr. Speaker. This is a very sensitive issue and is very important for those who are shielded. And I'd invite the Honourable Lady to the briefing with the Deputy Chief Medical Officer so that she can ask any questions that she has.
Rob Logan.
Thank you, Mr. Speaker. Since March, the government's top policy priority has been to save lives by preventing the NHS from becoming overwhelmed. Given this, the government have rightly been preparing for this winter by significantly expanding free flu vaccinations. Given that parts of the High Peak, including Glossopdale where I live, has just gone into Tier 2 restrictions, can I urge the Secretary of State to do everything he can to make certain there are sufficient flu vaccination doses available in the High Peak and other areas with extra restrictions?
Yes, absolutely. Not least because there is evidence that if you have flu and catch COVID, it is even worse. So the flu programme this winter is incredibly important, even more important than it always is. I'll look into and ensure that the rollout in High Peak goes well. I'm very glad to say that the uptake of the flu vaccine is much higher this year than it has been in previous years, and we have a record amount of flu vaccine, over 30 million doses available. So everybody on the priority list in High Peak who wants a flu vaccine can get one. They will be available over the forthcoming 10 weeks between now and Christmas, and I'm very happy to work with my honourable friend to ensure that happens for his constituents too.
We've found Rosie Cooper, so we're going up to Lancashire. Rosie Cooper.
Thank you, Mr. Speaker. 4 British teenagers in Sicily continue to test positive after 2 weeks of isolation. In Britain, they would be back in the community spreading the virus. So would the Secretary of State recognise a test, trace and retest system is needed to protect us, and when could that be implemented? And if I may, Mr. Speaker, what action can be taken to protect my West Lancashire constituents who via social media have been alerted to the fact that supporters who want to watch Liverpool versus Everton match this Saturday intend to travel from nearby Tier 3 areas into pubs in West Lancashire? This could be a super spreading event leading to a public health disaster.
Secretary of State.
Thank you very much. I'll write to her on the first point because it's a very important point, but the proportion of people who are still infectious after 2 weeks, if they don't have symptoms, is thought to be very low. I can't remember the figure off the top of my head, but it's very low, and I'll write her and maybe publish the letter to explain that scientific fact in full detail. On the second point, I strongly agree with her. The principle behind the levels is that if you are resident in an area that is in a very high local COVID alert level, then that level applies to you wherever you are. If you live in a lower alert level area and you travel to a higher alert level area, then the rules of the higher level apply if that's where you are. So people who live in the Liverpool City region should not be travelling to West Lancs because the pubs are open there. That contravenes the regulations, and I look forward to working with her to try to ensure that this doesn't happen.
Dave Dugan.
Operation Moonshot was the UK government's latest world-beating COVID intervention, but it seems perhaps that it's missed its target and is heading off into deep space. Mr. Speaker, the public didn't ask for world-beating. What they asked for was competent, and what they deserve is availability. So can the Secretary of State advise us, is there any positive signals from Operation Moonshot? When will it be rolled out nationally, or is it another testing failure?
Yes, it's going pretty well, actually, and it's going to benefit the people of Scotland as well as people right across this united land.
So, Desmond Spring.
What advantage is there to be had from accommodating non-intubated COVID cases in Nightingale hospitals? And if there is an advantage, what additional facilities would need to be provided?
Some of the Nightingale hospitals can take non-intubated patients, not ones that need full intensive care if they have multiple organ failure, but not all of them can because of the way that they're set up. We need the ventilators, we need the space, but we also need the staff to ensure that the Nightingale hospitals can be expanded as much as possible.
Florence Hesselhoff.
Thank you, Mr. Speaker. Yesterday, I received an email from my constituent, Anna Shipman, who's really concerned about the test, track and trace. And I'll read. I have a friend who's on a vaccine trial, and he has a routine test every Wednesday. And at the beginning of the trial, he would normally get his test results the next day. Now, Anna is pregnant, and she told me that her friend met her on Friday. Then on Saturday, he met his elderly mum, who's 75. On Saturday and Sunday, he then went back to work as a full-time carer, exposing extremely vulnerable adults. He didn't receive his test results until Sunday. This system is a shambles, Mr. Speaker, and we need the Secretary of State to highlight when we will protect vulnerable people who are being infected and not knowing because they're not getting results on time.
Secretary of State.
No, Mr. Speaker, the turnaround times are reducing, and while I absolutely whilst I absolutely pay tribute to the Honourable Lady for raising this individual case, it's very important to look at the system as a whole, where the number of tests is at a record level and the turnaround times are, I'm glad to say, reducing.
Jason McNaughton.
Thank you, Mr. Speaker. Is the Secretary of State currently having discussions with West Yorkshire leaders about our COVID alert status? Does he anticipate any change to our current status of high in West Yorkshire this weekend? And finally, can he continue to be guided by the localised data?
The localised data is very important, that we take the action that's needed on the as local as possible, as we have done in Kirklees over the crisis over the last few months. We're in constant dialogue with the leaders of West Yorkshire, but no decisions have been taken.
Nora Ali.
Mr. Speaker, Tower Hamlets faced one of the highest death rates in the country in the first wave of the pandemic, including for those among BAME communities. And for weeks, the borough's been given the lowest testing capacity in the capital, despite high incidences of positivity. Can I ask the Secretary of State to focus on the specifics and explain when he's going to get a grip on testing and tracing and localising it with resources, when he's going to get local authorities the resources they need and businesses the support they need, communities the support they need, and can he please explain today what action he'll take to produce the action plan that was promised months ago after the disparities report was published by his government?
Yes, absolutely, Mr. Speaker. And the Honourable Lady rightly raises the issues in Tower Hamlets. And the good news is that the testing being delivered in Tower Hamlets is going up. The bad news is that both the number of people testing positive and the positivity is also going up because of today's decision on putting London into level 2. That means further resources will be available for local test and trace.
Smith. Can I thank you for allowing me to get on at the last bit because of the London statement. Can I say to my right honourable friend, when a minister gets a collection of London MPs together, it would be great if they could actually be allowed to ask a question for long enough time to save them having to scrabble into the House of Commons. The second bit is, I want to follow my right honourable friend, the member for Bromley and Chislehurst. London is huge, whether people like it or not. It is very diverse, and each of the boroughs, many of them, are bigger than most of the towns in the rest of the UK. Surely we need to look again at the nature of this London-wide Tier 2 position, because there could even be regional areas that could be taken out. There are big disparities. Please think again. Otherwise, as one constituent has literally rung me today, he has said, is this in fact a London-wide Tier 2 to stop the north-south divide argument running?
No, Mr. Speaker. This just on this last point, absolutely not. This decision has been taken on the basis of the data across London, and we did consider the borough-by-borough approach that he understandably advocates. But the decision that we came to is that because the cases are rising throughout the capital, therefore it was right for the capital to move as a whole, and that was supported by the cross-party team who are working on this at a London level.
Dr. Rupert.
Ealing shot up, and in the last week its cases have doubled, making it now the capital's coronavirus capital. So can I commend his approach to do a London-wide situation on this one, given the fluidity of this and of our city? And can he resist the siren voices from opposite saying otherwise? Also, could he look now at sort of additional funding for areas like my own and other interventions that could help? He knows my position on vitamin D. I wonder if he's considered it could be a high-impact, low-risk, cost virtually nothing thing that would make him a hero. What is he waiting for?
On the first point, what I'll say is I will listen to all voices, and the voice of my right honourable friend is far from siren. It is thoughtful, and it is considered, and it represents his constituents. And I will absolutely listen to and consider my right honourable friend on this side, my honourable friend at the back over here, and the honourable lady in trying to get to the best public policy outcome, taking into account health and economic and social consequences of these decisions that we unfortunately, these choices that we are unfortunately faced with. And I think that we should try to carry that approach of listening to all considered voices. On the point about vitamin D, I have asked the scientists to look once again at the impact of vitamin D on resistance to immunity. There has been some updated evidence that's come to light in the last few weeks, and I want to make sure this is fully taken account. And I can also tell her that we will be increasing the public messaging around vitamin D to make sure that people get the message that vitamin D can help with your broad health and that there is no downside to taking it and therefore people should consider that.
Thank you, Mr. Speaker, and thank you for squeezing me in. I thank my right honourable friend for his statement, and I also thank him for his response to the honourable member for Harrow East earlier. It is so vital that we do have a pathway and an exit plan to take London back to Tier 1 as soon as possible. I am particularly concerned about the impact of local people and businesses in my constituency in central London, particularly on the mental health issues that we are facing. I met a businesswoman on Friday in the City of London, a beautician who is now on antidepressants because her business is failing. Will my right honourable friend please assure me that there will be the funding and the services for mental health available as we go further into this crisis?
Yes, Mr. Speaker, my honourable friend is right to raise these issues, and these are difficult choices that we face. She has raised with me previously the need for the plan for exit so that we can motivate people to do what is needed to get the disease under control in London. In her constituency, almost more than any other, the impact of decisions to restrict social life has a very significant direct impact. But on both the economic and on health grounds, what I would say is that the need to get this virus under control helps on both counts. Because if you take into account, for instance, the mental health impacts, having spoken to the Royal College of Psychiatrists, they are really clear that the mental health impacts, if this gets out of control, are worse than the mental health impacts of the measures that are necessary to keep it in control. But nevertheless, we've got to ensure that the services are there as well to support people.
Thank you, Mr. Speaker. I wrote to the Secretary of State on the 16th of September about the inadequacies of track and trace, and I acknowledge what he said today about the need for local and national teamwork. But I need to be further reassured that he will get track and trace right, because that's absolutely essential to dealing with the COVID-19 pandemic. London is now in Tier 2, and we've seen Manchester go from Tier 2 to Tier 3. So I want to ask the Secretary of State, we need to have a national circuit break for this to work, because otherwise we're going to have piecemeal Tier 2 going to Tier 3, and that isn't a plan.
Well, I would say to him, firstly, yes, absolutely, we're working. We want to work more closely with Ealing to make sure that we get that national and local link up in the test and trace system. I can give him that assurance. Just to be clear, in Enfield as well. Just to be clear that on the point about Manchester, no decisions yet have been taken on Greater Manchester, and I want to reassure colleagues from Greater Manchester in the Chamber. And finally, I would say that having this targeted approach is really clear for people to understand. There are 3 levels. Everybody knows what's in each of the 3 levels, and it's very easy to know whether your area, which of those levels you're in.
Limrag. News from Greater Manchester, where the impossible has been achieved. All of the members of Parliament, the leaders of the councils, and indeed the Mayor, surprisingly, are in agreement with one another. The meeting we had earlier today was entirely pointless and may as well have taught to a war, quite frankly, Mr. Speaker. When are we going to be properly consulted, learn about measures through the right channels rather than via the media? And can I put a question which I pose to the Prime Minister, to the Secretary of State now? The closure of hospitality will drive people into private dwellings where they will mix. We do not, thank goodness, live in a police state, for that would be the only way to police it. Can they please listen to common sense and think again?
Well, some of the evidence for the approach that we're taking is not only because we see this approach in other countries in the world, but also even within Greater Manchester. In Bolton, where cases were rising sharply, they were flattened when hospitality was closed there except for takeaways, albeit they have started to go up again since that measure was released. And so whilst I understand my honourable friend's urge for consultation, I'm very happy to talk to him at any moment of the day or night about these issues. We are seeking to work with the local area and with all of the elected representatives to get a solution that we can commend to the people of Greater Manchester, but a solution we must have. We cannot see cases inexorably rising because we know the consequences that brings.
Final question, Mike Kane.
Thanks, Mr. Speaker. I'm just slightly confused because on Monday, the Secretary of State gave up his valuable time to Greater Manchester MPs and confirmed Tier 2 with a 4-week review. This was Monday. He had the unanimous support, cross-party, from Greater Manchester. As the member for Hazel Grove has said, every day it's been briefed in the press that we were moving to Tier 3. So I am grateful to the Secretary of State that his minister, the Minister for Havisham, has today announced that there is going to be a leak inquiry by the department. Today, again, there was full unanimity about Tier 2 in Greater Manchester. Come on, Minister, just confirm it and you've got our wholehearted support across the conurbation.
Not quite, Mr. Speaker, because even in this statement, Mr. Speaker, there have been members speaking from Greater Manchester who have urged more action. And what I'd say to him is, I have started a leak inquiry into the leaks around some of the information around Greater Manchester. That will, of course, have to cover both national and the local government. But the question that we need to... There was a more important thing, though, which is the need for people to come together to take the action that is necessary to get this virus under control. Because, unfortunately, in Greater Manchester, there continues to be a rise in the number of cases.
Just a second. Mr. Kane, I give you the privilege of having the final question when you weren't on the list. Please don't abuse it. I also need to hear what's said because it affects my constituency. Secretary of State.
Mr. Speaker, very sadly, across Lancashire and across Greater Manchester, the number of cases of coronavirus continues to rise. The number of cases amongst the over 60s continues to rise. The number of hospitalisations continues to rise. And further action is therefore necessary. And I very much hope that we can reach the sort of cross-party agreement that we have had in London and that the local leadership in Manchester can work with us to find a solution, because it is critical that we get this virus under control.
In order to allow the safe exit of honourable members participating in this item of business and the safe arrival of those participating in the next, I'm suspending the House for 2 minutes.